Do PRP injections actually hurt? Most people assume it's just another quick and relatively painless shot, and while that's often true during the procedure itself, the real surprise comes a few hours later and it can catch people completely off guard. In this video, I'll show you exactly what PRP feels like, what's normal, and when it actually starts to work. Hey everyone, Dr. Jeff Peng here. I'm a sports medicine physician currently practicing in the San Francisco Bay Area, and I've helped thousands of patients navigate orthobiologic and regenerative treatments, including PRP injections. In this video, I'm going to walk you through what PRP actually feels like, both during the procedure and then the days and weeks that follow. We'll cover why the pain happens, how long it lasts, what's considered normal, and how to manage it the right way so that you can recover with confidence. So when people hear the words injection and platelet-rich plasma, they often imagine something intense or even scary. But the truth is, the actual PRP procedure is usually much more manageable than expected. Before we even begin the injection, we start by drawing your blood. That part feels just like any other routine blood test. We then process that blood to concentrate the platelets, which takes about 20 to 30 minutes. Once the PRP is ready, we prepare the area to be treated. Now, this is where most people start to feel nervous. But here's the good news. I always use a small amount of local anesthetic to numb the skin and underlying tissues. This significantly reduces discomfort during the injection itself. Now, you might feel some pressure or a dull ache during the injection, especially when we're treating a deeper structure like a tendon or a joint, but it's not the sharp, stinging pain that people often fear. In fact, many patients are surprised at how tolerable the procedure is. Most say it feels more like a pressure, a tightness, or maybe a deep squeeze rather than an actual pain. And it usually lasts only a few seconds to a minute or two, depending on the area that we're treating. So overall, the procedure itself is not as bad as people expect. Now, the part most people don't expect is what happens a few hours after the injection. Once the numbing medicine wears off, the pain can really start to ramp up, and for some, it can get quite severe. Now, here's the most important part. What most people don't realize is that this kind of pain is not a sign that something went wrong. In fact, it's a sign that the PRP is doing exactly what it's supposed to do. Unlike cortisone shots, which work by suppressing inflammation for fast but temporary relief, PRP takes the opposite approach. It kickstarts your body's natural healing process. And the first step in that process is inflammation. When PRP is injected, the concentrated platelets release powerful growth factors, and these growth factors signal your immune system. They boost blood flow, and they set off a chain reaction, an inflammatory cascade. This is what causes the pain, the swelling, the stiffness that you're going to feel during the first few days after the procedure. And while it can be uncomfortable, even intense at times, this early inflammation is absolutely necessary. It's how the body begins repairing tissue and builds towards long-term healing. Now, the big question is, how long does that inflammatory phase actually last? And it depends on whether we're treating a tendon or a joint. So let's first start with tendons. For injections into areas like the rotator cuff tendon or the tennis elbow, the inflammatory phase can last up to 2 full weeks. And during this time, it's normal to feel that soreness, stiffness, and sensitivity. And that discomfort, again, it's not a setback. It's your body doing the work of breaking down damaged tissue and starting the repair process. Once the inflammation settles, relief still doesn't come right away. And that's because tendons have poor blood supply and they heal kind of slow. Most patients won't feel any meaningful improvement until around 6 to 8 weeks. And for some, it may take up to 10 weeks to start noticing an improvement. PRP triggers healing, but it's a gradual biological process. Now, joints are a little bit different. So when we're treating osteoarthritis, the inflammatory response usually resolves a lot faster. Most patients find that pain and swelling improve within about a week, and range of motion starts to return. Joints also tend to respond much sooner to PRP. For example, in cases of knee osteoarthritis, many people begin noticing real improvements like less stiffness, better mobility, better function by around week 3 to 4. The real challenge is that many people never make it to that long-term relief. That early pain can be intense, and without clear guidance, it's easy to panic and do the wrong thing or maybe give up too soon. I've seen patients unintentionally sabotage their recovery simply because they did not know how to manage those first few days. So let's talk about how to get through that inflammatory phase the right way. This here is the exact recovery chart that I give to every patient after a PRP injection. It outlines what to expect over the first 6 weeks and shows shows you how to support the healing process in a way that reduces complications and maximizes long-term results. So what I want to do here is walk you through each one of these phases. Phase 1 covers days 0 through day 3. The goal here is protection. This is when the inflammatory response needs to kick in, so we don't want to interfere with it. That means no anti-inflammatory medications, no icing, and no aggressive soft tissue work. Avoid exercise and repetitive movement in the treated area. Instead, apply heat a few times a day and give your body the space that it needs to begin healing. Phase 2 spans days 4 through 14. This is where we start to reintroduce gentle movement. On day 4, you can begin light daily stretching and add easy aerobic activity like walking. Then by day 7, you can start incorporating light strengthening exercises. Aim for about 3 times per week. Anti-inflammatory medications are still off limits, and soft tissue work should stay controlled and minimal. Think of this phase as easing your way back into activity while continuing to respect the healing process. Phase 3 begins around weeks 3 through 6. At this stage, the inflammation has mostly resolved, and now we can focus on rebuilding strength, mobility, and endurance. You can progress both your aerobic and strengthening exercises here, ideally trying to do the rehab 3 times per week. If possible, still try to avoid anti-inflammatory medications so that you don't blunt the repair process. I typically recommend a follow-up visit sometimes between weeks 4 and 8 to monitor progress and fine-tune the rehab plan as needed. Now, one important thing to keep in mind is that these restrictions are specific to the body part that we treat. If you had a PRP injection in your right shoulder, it's just your right shoulder that needs protection. You can still walk, you can bike, you can train your lower body. If the injection was your left knee, you can absolutely do upper body strength training as long as you're not putting stress through the left knee. Again, the key is to avoid overloading the injected area while staying active in other safe and supportive ways. This phased approach is designed to mirror your body's natural healing timeline. It gives the PRP time to work while helping you gradually return to full function safely and effectively. Okay, so now that you understand what PRP actually feels like and how to manage your recovery, there's one more thing that you need to know. Even with the best treatment plan, small mistakes, especially in the early phase, can slow your progress and even wipe out the benefits entirely. And the truth is, most people don't realize they're making these mistakes until it's too late. So check out my next video where I break down the most common PRP mistakes to avoid and show you how to get the most out of your injection and recovery.